Hello everyone, welcome to sqadia.com, and now we will talk about progestogen-only contraceptives in our third section of the lecture topic, different methods of contraception. So progestogen-only contraceptives are available in different forms. So we will talk about different forms in which these contraceptives are available. These contraceptives have only progestogen in them, no estrogen. So these are only progestogen contraceptives. We will talk about the mechanism of action, how they are effective and how they can prevent the pregnancy. And what are the complications of progestogen-only contraceptive methods? Availability is they are available in the pill form also, like combined oral contraceptive pills. Progestogen only pills are available, known as the mini pill. Then we have another form available is the depot preparation, which is known as DMPA, depot medroxyprogesterone acetate. These are the injectable forms here. If you see, this is depot DMPA, depot medroxyprogesterone acetate. This gives the contraception for 3 months. So every 3 months, this injection is repeated. So it's better to get the injection one day before the time it's ending to get real good protection or effectiveness. It's better depot in terms that if somebody is forgetful and they forget taking tablets regularly, in this case they don't have to worry about every single day remembering the pill, and one injection is good for about 3 months. Then the other method of progestogen-only contraceptive is implants or norplants. These are subdermal. Dermal means skin. Derma. Sub means under. So they are implants under the skin, consist of 6 elastic capsules. Here in this diagram, if you see, these are the capsules like the implants, 6, which are implanted under the skin in the inner portion of the upper arm. Very, very effective. They release levonorgestrel. Levonorgestrel is slowly released from these implants, and they are effective for about 5 years. So it's a long-term long-acting reversible type of contraception. Once implants are removed, pregnancy can be achieved. So it's a good method of contraception, long-acting, reversible. So 3 main types of progestogen-only contraceptives, which are the pills, like combined form. The only difference is they don't have estrogen in them. Then the depot give protection for about 3 months, repeated every 3 months. And then we have implants or norplants, which are the subdermal implant system. Then the mechanism of action of progestogen only is mainly they increase the cervical mucus viscosity. Viscosity means thickness. So one combined oral contraceptives we talked about, they also increase the thickness of the mucus. So progestogen only have the same effect. They increase the viscosity, means thickness or flow. So they make the mucus thick and prevents the penetration of sperm into the vagina and access to the fallopian tubes to fertilize the ovum. Then the other important mechanism of action is they change the endometrium. The endometrium is the lining of the uterus, and the progesterone avoid bringing the changes in the endometrium, so it no longer is receptive for the fertilized ovum. So changes in the endometrium prevents the implantation of the fertilized ovum in the endometrium. And then the third mechanism of action, especially for the depot suppresses hypothalamic pituitary ovarian axis, and by inhibiting or suppressing hypothalamic pituitary ovarian axis, they prevent the ovulation to take place from the ovary, because no release of gonadotropic hormone from hypothalamus, and then luteinizing hormone from the pituitary, it can prevent the ovulation. Here in this diagram, these are the two common sites of getting the depot injection. Depot is very thick injection, so it's always better to get it into the gluteus muscle in the upper half of the buttocks, but sometimes it's also given in the deltoid muscle. So thick, it causes really bad tenderness and pain in the muscle, so its preferred site is to give it into the gluteal. It's upper and outer quadrant of the gluteus muscle. Here, these are the sites, upper and outer quadrant of the gluteus. And it's intramuscular injection, very thick. So it's long needle is used to give this injection. So we go deep, and from where the absorption is good. So this is the upper outer quadrant of the gluteus muscle, and this is 4 fingers below the shoulder. This is the landmark for the deltoid injection, roughly 4 fingers below the shoulder. This is the deltoid muscle. So these are the two common sites to give the depot shot. Then some of the complications of the progestogen-only contraceptives are should be avoided in undiagnosed bleeding and in breast cancer. Adverse reaction is mainly disturbance of bleeding pattern. Like we talked about in oral contraceptive pills, they don't affect the menstrual cycle. It comes every month when we stop taking the pill, or we are on the iron pill or on the depot. But in this progestogen only, there is disturbance of the bleeding pattern with implants or with depot injection. Usually there is amenorrhea slowly, no bleeding and no regular cycle, amenorrhea with the depot here. And there is usually prolonged cycles, and in between on these progestogen only pills, contraceptive, there is also spotting. Patient comes and complains they have spotting off and on, no cycles, no bleeding, and there are prolonged cycles. If there is maybe 3, 4, 5, 6 months no cycle, and suddenly one cycle there is a bleeding, so it causes very irregular type of cycles or even amenorrhea. That's the main complication of progestogen only contraceptive methods. So in third section, we covered the progestogen-only contraceptives, which were mainly the pill, and then we have the depot injection, and then the third type was the implants, subdermal implants, which are implanted under the skin. Thank you for watching sqadia.com.